Health insurers in crisis, the struggles of a $5.3 trillion industry. The healthcare industry's golden age may be coming to an end. Health insurers have been riding high for years, but storm clouds are gathering on the horizon. The $5.3 trillion behemoth that is the American healthcare system has long been a jobs powerhouse, especially for college-educated women. But now, the industry that seemed unstoppable is showing signs of vulnerability. Since the Affordable Care Act ushered in a new era of expanded coverage, health insurance companies have been Wall Street darlings. More Americans with insurance meant more customers and more profits. The shift toward government programs like Medicare and Medicaid created a steady stream of revenue that investors loved. But here's where it gets interesting: those good times may be coming to an end. The once bulletproof health insurance sector is starting to look a bit wobbly. What's behind this sudden change of fortune? And more importantly, what does it mean for the millions of Americans who rely on these companies for their healthcare? The reasons for this downturn are complex, involving everything from rising medical costs to changing government policies. But one thing is clear: the health insurance landscape is shifting beneath our feet. Some industry insiders are even whispering about potential consolidation or major restructuring in the years ahead. This isn't just a story about corporate profits, though. The health and well-being of millions hang in the balance. If insurers struggle, what happens to coverage and costs for everyday Americans? Will we see a push for more government involvement in healthcare, or will the free market find a way to adapt? These are the questions keeping healthcare executives up at night. And they're questions we should all be pondering. After all, in a country where healthcare is still largely tied to employment, the fate of insurers affects us all. What do you think? Is this the beginning of the end for the health insurance industry as we know it? Or is this just a bump in the road on the way to even greater profits? Share your thoughts in the comments. This is a debate we need to have as a society. The future of American healthcare may depend on it. ACA insurers plunge. GOP law triggers huge premium hikes and market fallout. The recent changes in the Affordable Care Act, ACA, landscape have sent shockwaves through the insurance market, particularly affecting companies that provide ACA coverage. On July 18, 2025, Elevance Health, a key player in this sector, issued a warning regarding the market's future, leading to significant declines in stock prices for ACA insurers. Health insurance providers that cater to the ACA marketplaces, which serve approximately 24 million Americans, experienced some of the most severe losses in the S&P 500 index on that day. Elevance Health reported disappointing earnings for the second quarter, falling short of Wall Street's expectations, which contributed to its stock becoming the worst performer in the S&P 500 for a significant portion of the trading day. It was only later surpassed by Molina Healthcare, another insurer facing similar challenges. Centene, yet another provider of government-related insurance, also saw its stock tumble. While Elevance's second quarter results were not catastrophic, reporting earnings of $8.84 per share against an expectation of $8.91 and sales of $49.42 billion that slightly exceeded forecasts, the company expressed growing concerns about its future. This uncertainty is largely attributed to a recent legislative development, a big, beautiful bill that passed through the GOP-controlled Congress and was signed into law by President Trump. This legislation will allow the enhanced subsidies for ACA marketplace buyers, which were introduced during the COVID-19 pandemic, to expire at the end of the year. The Congressional Budget Office has projected that the elimination of these enhanced subsidies could result in approximately 4 million individuals losing their ACA insurance in the coming years. This situation presents a dual challenge for insurers like Elevance. Not only will there be a decrease in the number of enrollees contributing monthly premiums, but the remaining client base is likely to be less healthy and have more significant medical needs. Typically, those who are most inclined to drop their insurance, often due to affordability issues, are the healthier individuals who feel they can manage without coverage. Gail Boudreau, the CEO of Elevance, highlighted the uncertainty surrounding the future of these enhanced subsidies during a call with analysts, stating, The biggest unknown for us right now is the policy uncertainties around the ultimate disposition of the enhanced subsidies in the individual ACA market. In response to these challenges, Elevance has already begun to increase the prices of its individual ACA insurance plans to account for the anticipated end of these subsidies. Boudreaux noted, "We've already repriced products for rising cost intensity." This situation raises important questions about the future of health insurance in the ACA marketplace. Will the loss of subsidies lead to a significant drop in coverage, or will new solutions emerge to fill the gap? As these developments unfold, it will be crucial for stakeholders to engage in discussions about the implications for both insurers and consumers. What are your thoughts on the potential impact of these changes? Do you believe the market can adapt, or are we heading for a crisis in health coverage?